सब्सक्राइब कीजिए लर्निंग फार्मेसी चैनल को एंड बेल आइकन को दबाइए लेटेस्ट फार्मेसी वीडियो सबसे पहले देखने के लिए। In the end of this video, we'll ask you a question. You have to answer that question so that you'll get to know that you understand this video well or not. So by means of that, you have to communicate your answer in the comment section below. So let's get started. So in this video, we are going to discuss Pharmaceutics Chapter 1.1 dosage forms of the drug, and what topics we'll cover. We'll see the introduction of the dosage form and the classification and example of the dosage forms. So let's see the introduction of the dosage forms of the drug. What are the dosage forms basically? Dosage forms are the carriers of or medium through which drug molecule delivered to the site of action within the body. So what does it mean? So for example, if you have a problem in your lungs or your heart, so by means of this dosage form, that kind of medicine can be delivered to that particular site to produce their action. So it's basically a medium through which we can deliver the medicine to the patients. Then dosage forms are the combination of drug and excipients. Excipients are also called as non-drug component. We'll discuss it about later, both the excipients and what are the how the medicines are prepared by mixing this active pharmaceutical ingredient and excipients or additives. Now let's see what are the active pharmaceutical ingredients, that is API and the excipients. So what are the active pharmaceutical ingredients? These are the chemical compounds that are actually used for diagnosis, treatment and prevention of disease. So basically the active pharmaceutical ingredients are actually responsible for producing any kind of effect which are desired by the body, which for which we are taking that medication. We'll see it later with an example. Next, the excipients, they are used in the dosage form to provide the dosage form a particular shape, to provide the dosage form the stability, for the palatability, so that that kind of dosage form can easily be taken, and to make that dosage form more elegant in appearance. So if we'll take an example of the paracetamol tablet. So in paracetamol tablet, the active ingredient, the ingredient which are actually responsible for reducing the fever is paracetamol itself. So you have seen this kind of instruction. Each tablet contains 500 mg of paracetamol C there. So this 500 mg of paracetamol is the active pharmaceutical ingredient, and the other ingredients you'll see that maize starch, potassium sorbate, purified talc, stearic acid, povidone and soluble starch. So these are the excipients that are included in the formulation to give it a particular shape so that it can easily be taken. So what are the different type of excipients that are used in the different types of dosage forms? First, the coloring agent. These coloring agents are used to provide particular color to the medication if required. Sweetening agent to provide the sweet taste to the medication. Flavoring agent to provide the particular flavor to the medications like mint flavor, chocolate flavor. These two sweetening and flavoring agent are basically used for the preparation that are meant for kids so that they can easily be taken. Then solubilizing agent to solubilize all the ingredients of the formulation. Antioxidant to prevent oxidation of the medication. Sometimes the medication got oxidized when exposed to atmosphere, so these are added, antioxidants are added to prevent that oxidation. Preservative to increase the shelf life of the medication, they were added. Suspending agent to suspend all the particles that are suspended into the solution, that are suspended into the medium so that they'll not get precipitated. Then binding agent to provide the particular shape to the medication. They used to add that solvents and lubricants and perfume to give a particular fragrance to the formulation. So these kind of excipients are used in pharmaceutical dosage forms. Now we'll see the classification and examples of the dosage forms. So first, solid dosage form, liquid dosage form, semi-solid and others. We'll see the separate example of each category. In solid dosage form, we have unit dosage form, and in that we have tablet, capsules, powders and pills. In bulk dosage form, we have fine powders and granules, dusting powder, insufflation and dentifrices. In liquid dosage form, we have monophasic liquid dosage form, In that we have syrups, elixirs, linctus and drops, and in biphasic liquid dosage form we have emulsions and suspensions. In semi-solid dosage form we have the dosage form meant for internal use, and in that we have suppositories and pessaries. And for external semi-solid dosage form we have ointment, creams, paste and jellies, and in case of others we have gaseous preparation, and in that we have inhalers and aerosols. Now there's a question for you. You have to answer that in the comment section below. So the question is, which of the following is not a semi-solid dosage form? So the options are cream, solution, paste and gels. So answer this question in the comment section below. So thanks for watching. In next video we're gonna continue our topic of dosage form, in which we'll discuss the brief explanation of all the dosage form that we have discussed in the classification on our previous slide. So if you like this video, please hit the like button. Please share this video with your friends. If you're new to this channel, please do subscribe to our channel by hitting this subscribe button. If you have any doubt or anything you want to ask us, let us know in the comment section below. ये कुछ हमारे रिलेटेड वीडियोस के लिंक हैं जिन पे क्लिक करके आप उनको देख सकते हैं। दोस्तों, लर्निंग फार्मेसी पे आने के लिए और ये वीडियो देखने के लिए आपका बहुत बहुत शुक्रिया। मिलते हैं अगले वीडियो में।